Hi, folks. My name's John Dubas. I'm with Premier Marketing. I'm in the Dallas office, and we'll be spending the next hour or maybe a little bit longer. Today's presentation is very comprehensive. The next hour 15 minutes or so, learning about the different Medicare Advantage options that you will have for 2019 for the Dallas market. Keep in mind that this presentation is being recorded, and you will receive a PDF of the presentation itself. So all this information you're about to get will be part of a follow-up correspondence that goes to all who have raised their hand with interest in this topic with our organization. A little bit of housekeeping notes, if you would. If you have a question, please type it in the questions box on the presentation, and we'll make certain that we answer them all as we can, and make certain that the ones of particular interest to the group are disseminated out with the follow-up as part of a frequently asked questions piece in the follow-up piece. We will also be sending different types of carrier information to those who request it. So as part of the correspondence goes out, if you have particular interest in a carrier that we go through, please let us know, and we'll make certain that the contracted agents get that information for their portfolio. A little bit of background, once again, kind of level set on who Premier Marketing is. We're a national marketing organization founded in 1968. That's part of the Integrity Marketing Platform. We have offices across the country, and we act as an insurance wholesaler offering insurance product through independent insurance agents across the country. Those contracts are generally vested with the highest possible commission levels available, and we do have recruiting contracts available to those who qualify as well. We mentioned a little bit about our organization starting in 1968, so a little math tells us, well, hey, it's our 50th anniversary this year. We're proud of that accomplishment. Our organization has come a long way from a family shop in a small town in Nebraska to the national powerhouse that it is, because we are one of the largest organizations in marketing Medicare Advantage and Medicare Supplement programs. We are the largest producer for the United Healthcare with their Medicare Advantage product. We're also the largest producer for Anthem and Meridian Care, and one of the largest with many of the other Medicare Advantage prescription drug and Medicare supplement companies as well. We do offer a full insurance portfolio for individuals. The Medicare programs include a portfolio of Medicare Advantage and Medicare Supplement Plans, along with standalone Part D prescription drug programs through various carriers throughout the country. We do offer a full portfolio of life insurance and annuity products, including final expense life insurance and pre-need programs. In addition, a large variety of long-term care and short-term care products are available. I should preface that a little bit, since long-term care carriers are diminishing in number, but there's still a number of good organizations out there for you. We do also offer disability income products, and as we go through some of our future webinars, the importance that we place on ancillary benefits, programs such as dental, vision, and hearing programs, critical illness programs such as heart attack, stroke, and cancer, and hospital indemnity programs will be very important for us as Medicare Advantage agents active in AEP, because of some of the commission guidelines given to us by CMS. So watch for that announcement coming up very shortly. That Medicare Advantage portfolio offers just about every national carrier and several regional carriers as well. And we also offer a full portfolio of standalone prescription drug programs. Additionally, our Medicare Supplement portfolio is very large, and within the last month, we actually launched a couple of Medicare Supplement programs called Lumico and Union Security that have some very interesting marketing support and also compensation programs, in addition to very competitive rates from A-rated carriers. So some additional information available to you across the board in the Medicare Supplement world as well. What we'll be doing today, however, is going through a number of the options that you have in the Medicare Advantage arena and what we're referring to as the Dallas or the Dallas-Fort Worth market. If you look at it from a 40,000 foot level, or however you want to place it, Dallas-Fort Worth is a very large Medicare market, one of the top 5 in the country, and different carriers will have different definitions as to what the Dallas-Fort Worth market is to them, going from 3 counties to 16 counties. So that will vary a little bit. We're going to base a lot of our information off of some of the programs that are most widely available, so we can gather in the largest sample of Medicare Advantage programs for you. And to do that, we reference the programs that are available in 2018 through Medicare.gov. And what our research has found is, well, there's a whole lot of hog and a whole lot of lipstick to go around. So if you look at some of the Metroplex zip codes, a zip code in North Dallas has 41 plans, Medicare Advantage programs with drug benefit embedded in the program as part of the program. And if you go into a Tarrant County zip code, there's 37. You go up in the Denton County, 14. Go out toward Rockwall, and you've got 22. And then if you go into Collin County, you've got 35. So it depends upon your perspective. So we've pulled a number of programs based out of the Dallas zip code 75248, simply because there were more of them, and we wanted to give you a broader scale as to what is available. In that zip code, these are those plans that are currently available to you in 2018. There are a number of programs in there that, quite frankly, they aren't commissionable. So we can strike a few of them from our mindset in that fashion. When you look at some of the programs that are labeled Star Plus programs, or are one of the carriers that are administrating the Medicaid managed care benefit in the state of Texas, many times those plans are not for sale by our organization or by any other organization that offers feet on the street through an independent insurance agent, simply because those are demonstration programs put out by the government that combine a Medicare and a Medicaid program into one, and is not a sellable product for an agent force, for an agency in this particular market. So as you go through there, you'll see an amazing array of programs that are there for you. And of those, well, you go across the markets in the state of Texas, there's a whole bunch of them that are dual SNP plans as well. Does that mean we don't want anything to do with them? No, not at all. We want to make certain that we leverage these dual special needs programs, that so we are offering the absolute greatest amount of assistance to our prospects and clients, not only serving them better, but also helping us with our retention, driving up our persistency, because we're doing what we need to do for our prospects and clients and delivering the best, that's as close as you get with the use of a superlative, options that are available to them. We utilize Medicare.gov to come up with this data. Obviously, you go to Medicare.gov and you're able to pull up different health plans that, based on particular zip codes, will give you data. If we go back clear into this picture, you'll notice in a time period where we've passed October 1st, this website will actually give you current year data and data for the next product year. So after October 1st, they will list all the programs that are available in a particular market, and you can toggle back and forth between the current year and the next year's program. What it also does is gives you an opportunity to go in their special needs programs and click a couple of extra types of plans to make certain that you are looking at all of the Medicare Advantage programs that are available to you. You'll notice in that area that we don't click the third type of special needs plans, and that's for programs that help people that are in long-term care facilities, not because we don't want to approach that market, but once again, somewhat like the dual demonstration products, the majority of those programs are not commissionable, and many times they're only offered through an employee of the carrier that is offering that program. So in the dual special needs world, or in the special needs world, there are three types of SNP plans. One for the dual population, folks who have both Medicare and Medicaid, for folks who have certain health histories, and for folks that are in long-term care facilities. As independent insurance agents, the top two types are generally commissionable. The third type is not. So it's a distinction we want to make. Not that we don't want to help people, it's just that we want to make certain that we're also compensated for our efforts as well. Once we go into that type of parameter, then it gives us the idea of how many plans are available in different zip codes. In this particular search for benefits in a zip code in the Louisville area, there were 30 plans available. It'll give you a view of 10. You can strike it for a view of 20, or you can view them all into a singular page, and it'll give you the information that comes with it. One of the reasons we do this, obviously, is because this is such a burgeoning market, and with a larger population it becomes evident that even with that, there are different opinions as to what would be the best coverage for a particular individual, and we want to make certain that you have the information at your fingertips to help determine what that may well be for your particular prospect and client. As we go through the year, obviously, and we pass December 7th, we go by the anniversary of Pearl Harbor Day, we enter into a program where it is no longer the annual election period, but some things have changed as to how we operate after the first of the year. And one of the things that we need to keep in mind are the availability of special election periods. So as we go through and speak to people now, since their circumstances may change, even if we're not able to sell them during the annual election period, because of certain circumstances, they may qualify for that special election period and become a prospect later in the year, even though we've gone into the infamous lock-in period. That includes agents, that includes people with different chronic conditions. I mean, if you look at the Medicare population overall, 66% of them, 2/3 of the Medicare population have 3 or more chronic conditions. And we're seeing that across the country in a multitude of age groups. But in addition to what our bodies are doing, sometimes our wallets affect our options as well. And if a person can qualify for certain assistance programs, low income subsidy, extra help programs for medication assistance, cost of medications, or Medicare savings programs, MSP programs that may cover different costs when it comes to Part B and deductibles and coinsurance, it gives us an opportunity to market year-round with a good piece of the Medicare population eligible for a special election period. So that's one of the reasons we delve into this in such detail, including the SNP programs as part of our overall approach. One of the things that I would always ask people to do is, even though a plan is labeled a special needs program for a chronic condition such as diabetes or stroke or COPD or another one of the trigger chronic illnesses, even though it's labeled that plan, it still may not be the best option for them during open enrollment. We need to do an examination of their total package of requirements in order to help determine what may be the best option for them. Because keep in mind, half of the sales are sold during SEP. We're coming up on a very frenetic period of marketing within our niche, within the Medicare world, but half of the MA programs are sold during set periods, and we keep in mind as well a little bit of an inverse of product that a whole big chunk of the Medicare supplement programs are also sold during AEP, even though those programs are not subject to MIPA requirements and can be marketed year-round if the person can pass medical underwriting. So what about 2019? Let's go back and look at some of the changes the government put in during the marketing requirements, the call letters, and some of the other pieces of direction that they had given us clear back in April. And one of the first things that comes about is the dissolution of the Medicare Advantage disenrollment period, the MADP period, which had been in place for the last few years between January 1st and Valentine's Day. This program will be, or this proviso will be substituted with a step back in time where we go back to a switch period for the first 3 months of the year. So this gives the person the option to pick up a Medicare Advantage program during open enrollment, give it a little bit of a test run, and then during the first of the next year, see if it still fits or if it fits their best purposes, because they may not realize some network constraints that may be part of the program. They may not realize some of the differences that have come about based on formularies of medications that are available to them in the embedded drug portion of the program, or where those medications fall in the different tiers which dictate what their out-of-pocket expenses are. There may be a number of reasons why a person would reconsider their choice in the period that comes up in the switch period, which is the annual, well, now the Medicare Advantage open enrollment period, which will run the first 3 months of the year. So it gives the individual an opportunity to switch to a different Medicare Advantage program. It enables the individual to drop their Medicare Advantage program and go back to original Medicare with Part A and Part B, and gives them the option of picking up a Medicare Part D prescription drug program if they go back to original Medicare. It does allow them also the opportunity to drop a standalone Part D program, which obviously is generally not in their best interest if they don't have some other sort of creditable coverage for it. Keep in mind, if an individual goes into this circumstance, drops their Medicare Advantage program, goes back to original Medicare, picks up a Part D plan, it does not create a guarantee issue opportunity into Medicare Supplement programs generally. So that is a little bit of a proviso for them. If they're looking to go back to a Med Sup program with a Part D plan, they got to qualify for that Med Sup program medically. Once again, the list of the programs that are available in Dallas County in 2018, a breakdown of that list tells us that it is available through a large number of carriers in our market. Molina, Superior Allwell, United Healthcare, Amerigroup, Humana, WellCare Texan Plus, Aetna, Cigna HealthSpring, Karen Care, Baylor Scott and White, and Blue Cross Blue Shield were insurance carriers that were offering and are offering a Medicare Advantage prescription drug plan in Dallas County in 2018. You'll note as we break down some of these different carriers that we then look toward 2019 and we realize that these programs are all subject to change, the information we're about to go through. So this is our legal disclaimer for the remainder of a large portion of today's presentation, is that the plan designs and service areas that are described in the documents we're about to go through are subject to a change. They are still pending government approval, and they may reflect pending in-network cost sharing. So there are a possibility of other limitations and exclusions applying, and the star ratings are current as of July of this year and are subject to change in October. Many of them may stay the same star rating, some will drop, some will gain star rating. This presentation and the content within is intended for agent use only. Presentation's not intended for the use of marketing material to the general public. And keep in mind that the rankings or the order in which we present the material is not intended as a ranking of benefits or carriers, nor is it to be interpreted as the preference of our particular marketing organization. Kind of read through that, and I usually don't read through slides, so that means there are legalities involved, and keep in mind that this is intended for insurance agents for their planning of their marketing activities going forward in this market. We will be having additional presentations for other markets as well, and even for some specific carriers for the entire state. If we look at the programs in 2018, we look at the Molina plans that are offered. In 2018, they offered 2 MAPD programs. One is a STAR demonstration plan, so that's that dual demonstration product that, once again, I mentioned is not generally a commissionable product and is administered by the state and the federal government in conjunction in a singular health plan, and they offer an additional SNP plan as well. Molina does not offer a standalone Part D program or a Medicare Supplement Plan, and in all fair disclosure, we don't contract with Molina here at Premier Marketing. The Superior program that is listed in the benefits types, or actually the plan types that were in a couple of additional slides prior to this, are, well, it's a program that is, once again, a STAR Plus demonstration program. Superior All-Well does not offer a Medicare Supplement Plan nor standalone Part D program, and it is a sister organization to All-Well, which we'll discuss in a little bit moving forward. When we look at United Healthcare in 2018 in this zip code, they offered 3 MAPD programs with the United Healthcare label, and they offered 4 with the Care Improvement Plus label. Keep in mind, Care Improvement Plus is a wholly owned subsidiary of United Healthcare. Moving into 2019, they offer 3 MAPD programs with an additional 4 MAPD programs through Care Improvement Plus. They are the insurance underwriter for the AARP Medicare Supplement Plans, and they also offer the AARP branded Part D prescription drug programs as well. Their contracting is a singular contract for Medicare Advantage, Medicare Supplement, and prescription drug plans. So it's a single contract that a person goes through. It is the one Medicare Supplement plan that has a couple unique twists to it. It does require a fairly simple piece of certification. No other Medicare Supplement plan does that. And it is a Medicare Supplement program that does not allow you to cold call. Don't do that. It'll cost you your contract, and that is a distinguishing factor for that Medicare Supplement plan. It doesn't preclude you from marketing once you have demonstrated other product and you get in the household and someone asks about it, or if it comes up, obviously you can pursue it, but you're not to cold call for that supplement program. United Healthcare is one of 2 carriers that offers MA plans in every county in the state of Texas. Their eligibles for their programs is well in excess of 4 million individuals. They have a strong year-over-year eligible growth in Texas, and Medicare Advantage programs are less than 1/3 penetrated into the Medicare population. That is a substantial number, but it's low when you look at it in comparison with other states. The United Healthcare has been in the market on a continuous basis since 1985, and part of that reflects in their market share. They have over 40% of the market in Medicare Advantage in the state of Texas, and in certain key markets, it's higher than that. So a lot of cases, when you run across an individual with Medicare Advantage in the state of Texas, well, it could well be United Healthcare. When you look at some of the benefits that they have across the board, this gives you a breakdown of those benefits by market. So when we look at North Texas, we're looking at a grouping of counties that has over 1 million eligibles as well. So it's this market. It is North Texas, a number of counties that we'll roll through here in just a second, but it gives you then a number of options that are available for different health plans. It has one of the largest networks in this market, and also has some unique additional benefits that aren't always commonplace within the market. It is generally very well-rated programs as well, which tells us a couple of things, that the benefits tend to run fairly steady year over year. And as I mentioned, When you look at the MA penetration into this market, overall in the state of Texas, they were a little over 41%. In North Texas, they're a little over 61%. Sometimes an agent would look at that and go, well, gee, they already have United. Why do I offer it? Well, that's 61% of the 31% penetration, or in this case, penetration of 25%. So there's a whole bunch of people out there on Medicare that don't have an MA plan, which means they don't have it with United or any other carrier. So something to consider. Keep in mind these benefits will be sent to you for study. We just wanted to make certain that you get an overview of these, so we're not going through them line by line. What these two side-by-side plan comparisons do for you, though, is it identifies what United Healthcare considers the North Texas market. So you're looking at Collin, Cook, Dallas, Denton, Ellis, Fannin, Grayson, Hood, Hunt, Johnson, Kaufman, Parker, Rockwall, Tarrant, Van Zant, and Wise counties. United places emphasis on the availability of zero premium programs. Their benefits are generally really competitive. And this lays that out for you. They do offer an HMO program at $74 a month in addition to the zero premium plan in this market. And you'll notice that the benefits as a result of that premium do reflect the additional monies going into the plan. When you look at some of the other benefits that are available through CIP, these are programs that once again are available in every county in the state. And you will see that the regional PPO did take a price increase for a premium. It went up to $39, and they do have a tier deductible in tiers 3, 4, and 5 for the prescription drug benefit. You'll notice, however, though, that the chronic program's premium decreased, as did the secondary regional PPO program where the specialist copay went to zero. So it's a very incredibly competitive program, a portfolio of programs that are available year-round in the state. The dual products that are available through United Healthcare, through their community and state programs, well, they're pretty well represented across the state as well. So keep in mind, one of those CIP programs were also a dual SNP program is available. These are dual SNP programs that are available with the United Healthcare label on them. Dual SNP program is a great opportunity for agents that choose to pursue that market. There are a number of insurance agents that don't, simply because there aren't necessarily excess funds to buy other products. However, this is a product that has, up until the end of the year, a continuous special election period, which means the individual could take and change their coverage month over month. Going into 2019, that special election period changes to once a quarter, once every 3 months. So that's a very important point to consider. It also is an under-penetrated market, so you have a lot of opportunity. And in all honesty, this is an area with all the carriers' dual special needs programs where in essence you're paid twice. You're paid a regular commission like the other MA plans, but this is an area that will give you an additional intrinsic reward. Working with the population can be very gratifying, very satisfying. You just get a good feeling a lot of times doing it. This will then lay out the different programs that are available to you with the dual plans across the board and where they are per market. Because the benefits, even though they are D-SNP plans in different markets, they will vary from market to market when it comes to the program's benefits, particularly when you consider the so-called extra. So something to look at there as well. This continues that same sort of information for the different markets, going through them. When we look at the Dallas-Fort Worth market, they've been in this market very consistently across the years. Benefits have been very consistent, great network, just a great opportunity for a lot of folks. This then continues that same conversation in different markets across the state. and then we go into the programs that are available through Amerigroup. In 2018, they offered 2 MAPD programs in this market. In 2019, moving forward, they're adding an additional Medicare Advantage prescription drug plan. They do offer Medicare Supplement programs. Starting back in June, they began to offer those programs on an independent basis. It's a standard Medicare Supplement plan branded by Anthem. We can get you information on that, of course. And then, of course, they offer prescription drug plans as well. They look at the market with a lot of the same numbers that you will see when it comes to the overall beneficiary population with the agents, and give you some of the penetration through the markets that they exist in. And it is a little different product footprint than what we saw with United Healthcare. So they'll look at specific markets a little bit differently. They've got areas where they've added additional plans and have expanded their service area as well. We speak to their Dallas markets, where you've got the 4 core counties of Dallas, Collin, Tarrant, and Dallas counties, but you see that in addition to the addition of the 2 northern core counties, they've also added Wise, Jack, and Clay counties. So an expansion of the product footprint and multiple types of plans that are available to it. They have added a second dual SNP program in the Dallas market, so it's different than the program that they've had in place. That still remains, but they've added a secondary dual SNP product and have enhanced a number of the benefits. Anthem is one of the carriers that is taking advantage of CMS's direction that allows the Medicare Advantage carriers to diversify some of their benefits, and they have initiated a somewhat unique flex benefit program that can offer different types of benefits. So it enables the member to pick one of 7 benefits to improve their health and well-being in certain key areas. And that detail is left to the discretion of the beneficiary. So when you look at the 7 different pieces that they have, well, my math is a little off, because in this market, 5 have been currently approved with additional programs possibly available. You see nutritional support, post hospital stay, additional mobility benefits, personal aid benefits, the ERS, emergency response assistive devices that is available, and then an option available for adult daycare as well. What you'll see in these areas is an influencer that may come into play with a caregiver or someone else that has influence in the beneficiary's decision as to their health care. It is a 0 premium plan where they have added the additional counties that I mentioned, a very solid and competitive max out-of-pocket. Benefits overall are really strong, and they do not have a deductible for the prescription drug benefits for any of the tiers. So a lot of information that comes into play that is very helpful and very, very competitive with Anthem. So we roll through the benefits and get to the choices that they have with their dual SNP programs. You'll notice that some of the key differences lie with the dental benefit and the over-the-counter benefit and the transportation benefit. So there are some interesting differences that come into play with the programs, and it helps you then give your prospecting client the option of selecting which benefits they feel are more necessary for their needs. They do also offer a local PPO program in the market with solid benefits as well, and a solid dental benefit, or pardon me, a prescription drug benefit with some preferred pharmacies that are the name pharmacies in our area, to the point where some folks, they might shop at HEB all the time, but they don't know what that means. Well, it's Henry E. Butts, the guy that establish that company, and it is one of the must-haves for folks in certain parts of our fine state. The Medicare Supplement Programs, as I mentioned, has been recently introduced. It does have a 12-month guarantee and includes the Silver Sneaker programs. Forgive me for not going through some of the AARP pieces, but we did just have a webinar on it today, and I'll make certain that the link to that presentation is included. When you look then at one of the other big boys in the market, we speak about Humana. In 2018, they offered 7 MAPD programs in North Texas. In 2019, they have that same offering number available, and they do have standalone Medicare Supplement Plans, Part D programs, and some ancillary benefits that include dental programs. I'll mention ancillary products with a number of these carriers simply because we're going to make certain that you know the options that are available in that regard to further take care of the needs of your prospects and clients, but also to make you mindful of the fact that all of our Medicare Advantage payment programs, the commissions that you're due for the sales of these products, because of CMS guidelines, they're not payable until after the first of the year. Ancillary products are paid as they're issued. So that's a way for us to make certain that we are abiding by not only serving a complete evaluation of our prospects and clients' needs, but also a little bit of an evaluation of our individual wallets. When we look at the dual special needs programs that are available from Humana in the state, you'll notice there's a category they consider as a Value Plus program. In certain circumstances, this is sometimes referred to as a DSNP lookalike. The programs that they offer are strong programs. Humana, much like a number of the other organizations, have invested heavily in their benefits. One of the things that we see as a differentiator with Humana in Texas year over year as we evaluate these plans is you didn't see a lot of service area expansion. Well, heck, they're in every county like United Healthcare is in the state of Texas, but some of their market-specific programs did not see a expansion of that service area. So some very strong benefits that are available as well. You'll see that they offer a dual SNP program in every county in the state, and very competitive standalone Part D programs. If you are one of the agents that has participated in retail market venue marketing opportunities, translation, a lot of folks right away think of Walmart. Well, Humana is a big player within that, and they actually have a standalone Part D program that is co-branded with Walmart as well. When we look at some of their regular Medicare Advantage programs, it lays it out for you across the board with the benefits that are there for you. One of the observations that I had in the past with Humana is many times their maximum out-of-pockets were at the maximum allowable. You'll notice this year and in 2019, that's not the case. You see a little bit of variance on that with a very competitive max out-of-pocket in certain areas as well. So as we go into some further detail of some of the areas that kind of loom around the Metroplex, or they refer to as the DFW rural market, we included it in today's presentation because a number of those counties are in one of their main competitors, United Healthcare's service area for DFW. You'll notice that these plans generally aren't quite as rich in some of the benefits, but they are still very, very competitive and are one of a select number of plans that could be a very valuable option for you should you travel south a little bit into the cost plan exit areas. So something to consider. When we look at Allwell as an alternative in the Metroplex, in 2018 they had 2 MAPD plans. That's what they're offering in 2019 as well. They lay out their information much differently than any of the other carriers, as you'll notice. You'll notice that their service area isn't quite as extensive as some of the other folks that we've already referenced, but still over 1.7 million eligibles within their service area, and they lay it out by plan type. How's this going to help you? Well, the plan types are translated moving forward here. So you'll notice that the service area is a bit different than the 3 carriers that we've already addressed. Fewer counties available, but a lot of the emphasis here are based on dual programs as well. Not to say that their regular MA plans are not competitive, it's just a little bit different animal in this regard. You'll see that some of the programs are laid out and labeled as superior health plans with some all-well marketing attached to them. You'll see that many of the programs are available at a 0 premium, many being all 6 on this page, most certainly, with some very competitive benefits as well. When we look at the dual special needs programs, you'll see that they have some very competitive additional help as well, and that in certain service areas, it's a little different than what we see for the previous 3 carriers as well. A side-by-side comparison, one of the things that comes into focus for us when we just take a quick glance at the benefits overall is their star ratings, since they haven't been established in many of the markets as long as some of the others are a little lower than some of the other carriers, but they attempt to make up with it on different benefits as well. When we look at WellCare and Texan Plus in 2018, they had 7 MAPD plans in North Texas. In 2019, they go to 5 plans, and they do offer a standalone prescription drug benefit as well. What you'll see moving forward into 2019 is 2 carriers of sort that are now integrating the contract into one. So in 2018, if you sold WellCare and Texas Plus, you did so under 2 separate contracts. With the programs in 2019, it's a singular contract. Some of the benefits that they have in play, well, it is once again a different service area, so they have a different amount of eligibles that are available to them. The benefits are very competitive and give you some choices across the board as well to market year-round. So some things that come into play when you look at some of the pieces that have a particular allure in certain markets. When you look at the Aetna plans going into 2019, in 2018 they had 3 MAPD plans in the North Texas market. They've added an additional plan in 2019. They are also placing an emphasis on portfolio sales, and they're able to do so because they have standalone prescription drug plans that are very competitive. They offer Medicare supplements under some subsidiary companies, and they have a strong ancillary product. So when we look at one of the plans in specific for 2019, it's a program that offers a Part B buyback, fairly substantial, and enables you to offer additional Aetna ancillary product at basically a net 0 cost to the beneficiary. However, it is another commissionable product for you that takes care of a need of your prospecting client and is a commissionable product that pays before the first of the year. So something to consider in that aspect. What you have here is a bit of a combination with Aetna. They have added some expansion counties, but one of the things that they also did was took a number of existing counties that had been non-commissionable in the past and made them commissionable moving forward in 2019. With some of the product overlay in Central Texas, even though today is about North Texas, that gives us an interesting opportunity in cost plan areas in our state, which you'll see that a lot of the area that rims the Metroplex is now commissionable, where in the past it was not. They are really rolling through with some aggressive benefits in addition to adding service areas. And so what you have, that fourth plan now that is available is the one I referenced just a bit ago. That is a 4-star rated PPO program with $104 Part B give back. That makes an interesting opportunity for us in many situations for folks where that could be their best option. You'll see as it lay it out side by side that you have a zero premium HMO program available, a PPO program with a modest premium, one with a higher value premium, where you were seeing that with a lot of the different carriers, where they'll offer a separate MAPD program with a premium attached to it that really drives down some of the out-of-pocket expenses in different areas. And then the unique opportunity that's offered with the buyback program that still has very competitive benefits, but a net cost of, well, we're paying you $104 to take the program. And you can use some of those premium dollars to access critical illness programs, hospital indemnity programs to help take care of the hospital daily copays, and additional benefits that are made available on dental as well through the program. There are additional service areas that are available in areas that are non-metro, and we will still have access to them, obviously, out of our service area. And you go not very far into East or North Texas or out into West Texas, rimming the Metroplex. That's why we have this on today's presentation. When we look at Cigna HealthSpring, we're looking at a carrier that in 2018 offered 3 MAPD programs. In 2019, they're offering 4 with a competitive standalone Part D drug program. There are Cigna Medicare Supplement programs that are available that are very competitive as well. And they also offer ancillary products. So some of that same mindset of what we do moving forward, you're offering basic health coverage and you're looking to supplement that coverage with other products that cover a specific need or a fear that an individual has. And I didn't mean that to sound in that fashion, but there are those of us who have fought cancer that realize that additional coverage really can make a difference when it comes to your state of mind and the state of wallet when you deal with that dread disease. This is a carrier that is coming off a recent sanction. They don't phrase it as sanction, but that's what's happened. And so you're seeing them look to aggressively offer programs with a growth focus that offer strong ancillary benefits in key markets across our state. So some nice additional benefits with strong across the board product that is available. They offer in certain markets a HMO program with a small premium or a zero premium plan as well. So some things that can really satisfy the needs of folks in the Metroplex with a full choice of benefits coming to it. They are one of the carriers that offer an MA program only. You'll notice that when we went through United Healthcare, their MA Essential program is no longer offered. This and Humana, Cigna HealthSpring and Humana aggressively market an MA only program, a lot of it aimed at the veteran population. When we also look at a regional carrier in this market, we look at Care and Care. In 2018, they offered 3 plans. 2019, they're offering 4. They are very, very competitive in their benefits. And I say this because we have contract pending with this organization. We don't offer it now at this particular point in time, but it is a program you need to be aware of if you market in the North Texas market and look at some of the advantages that the program has for you with an HMO plan, a PPO program, a choice PPO program with a premium and advanced benefits in certain areas as well, and then an MA only program much as what I mentioned with Cigna HealthSpring and Humana just a moment ago. When you look at Baylor, Scott, and White in North Texas, you're looking at a health plan that has allied itself with one of the premier deliverers of care in different parts of our state. The Baylor name is very strong in North Texas. Scott and White, that's the plan delivery system, the provider of choice in Central Texas. In 2018, they offered 2 plans in the Metroplex. In 2019, they're offering 1 plan in the Metroplex. This gives you an idea of how they are dealing with the legislation that mandates the sunsetting of cost plans. In all honesty, not really a big factor in North Texas. You get down to Waxahachie, Waco, go south, clear down into even Round Rock, and you will see a change in those sorts of needs or things that will come to you as well. In North Texas, they substantially changed their benefits. They've gone from a 0 premium to $41 a month premium, and the benefits reflect some of the challenges that they've seen in North Texas. So some things to consider. There will be folks that will want this program simply because they have access to every Baylor facility in North Texas. No other carrier can say that. They can say they have parts of Baylor in their network, but this is the plan that has access to all of it. So it lays through some of the different coverages that they have with prescriptions, and then a side-by-side piece. You'll notice that in the original piece they laid out to us in an earlier iteration of the benefits, it was a $41 premium. As they go through, went up $2, it's up to $43. So additionally, what we have is some additional information on Blue Cross Blue Shield in North Texas. I apologize for the dearth of information as compared to some of the other carriers, but it is a circumstance where Blue Cross Blue Shield has reduced the overall number of plans that are available. But if you've lived in Texas for anything longer than 6 months, you know that the Blue Cross Blue Shield name is very strong in this state. A lot of it reflective upon their under 65 coverages and the group coverages they have active in the state. They do offer a strong Medicare Supplement program and a strong Part D program as well. Keep in mind that even though this and AmeriGroup, Anthem in many circumstances are considered Blue Cross Blue Shield plans, this is a separate contract, a separate entity. It's through the HCSC contract as opposed to the Anthem contract. And what they're looking to do is become very aggressive in 2 markets, DFW, the 4 core counties, and in San Antonio. So if you market in the 4 core counties, Dallas, Collin, Tarrant, and Dallas County, forget Dallas County. They have some unique marketing support programs that could be very, very helpful for you. We also have the possibility of new entrants coming into the market in 2019. I am usually a pretty good snoop when it comes to that. In Dallas-Fort Worth, I am unaware of any new entrants at this time. There are additional options being introduced into other parts of the state, notably a big name brand med sup carrier introducing an option in Bexar County down in San Antonio with Mutual of Omaha. That's not an entrant into Dallas-Fort Worth. When you look at all these different carriers, then what are you going to do? You're going to contract with all of them. You're going to certify with all of them. There are some folks that do. And then there are some folks that realize, that you have to sometimes look to serve fewer masters. And part of that will lay down into some of the extra benefits that are offered by the programs. A very important consideration is the network that is involved, not only just primary care providers, but all providers that are part of that network. And much as what you discuss with a Medicare beneficiary, you look at the family primary care doctors, you look at the specialists, you look at the hospitals, you look at the DME carriers, the durable medical equipment carriers, you look at the home health agencies and all the other pieces that come into play to help someone be comfortable with the choice they have selected as their carrier for the next year. Keep in mind, as a reminder, well, those first 3 months of the year with kind of the switch time, you have an interesting change that takes us back a few years to once again when Medicare Advantage programs received funding back after the Clinton administration had changed some of the funding there at the turn of the century. You also may consider the carrier support that is available to you from these different organizations. They're all getting better about offering agent manager support in particular markets. There are some that offer more than others, but there is also the opportunity you have in certain marketing situations. Do they offer a retail opportunity? How are they with community meetings? How do you work grassroots marketing with them as well, including marketing with key providers? Some more better than others at it. It's a choice that you have to make, and it's something to be very carefully considered. There is also how easy are they to deal with when it comes time to contract and certify, and not only certify, but then deal with the agent support desk that awaits you should you come across the challenge during an enrollment or post-enrollment. Some companies are better than others there too. Some are very strong when it comes to how quickly they get to you on the phone, others not so much. And then, of course, look at not just commission levels, but when they pay. And that can make a big difference to you. Some of them during a regular time of the year, not annual election period, where payment schedules are dictated by the government, where your AEP activity for a 1/1 effective is only payable after 1/1. You look at some of the systems that are in place, how good they are at paying you, and how comfortable you are with what you need to take care of when it comes to your pocketbook as well. So some of the things we're looking to roll out is to make certain that you're aware of the options that are available to present to your prospects and clients across the spectrum of Medicare beneficiaries. When you have a median income in the Medicare population of $24,000 to $25,000, a big portion of that market is dictated by financial need, spending out of a wallet, and a lot of that will direct much of the marketing pressure to Medicare Advantage programs. How can you then make certain that you do what's best for that individual or offer a full portfolio to folks that want a Medicare Supplement Plan and you take care of their prescription drug and other ancillary needs as well? So watch for some additional training and suggestions on that in the very near future. We do offer a very simplified way of contracting with many of the carriers. Many of them have their own electronic systems that are dictated by the company, but we try to make that enrollment process as easy as possible for you. And if you're looking to do ancillary products or Medicare supplement products, and many times establishing a profile with Insurance Bay will allow you to contract with multiple carriers much easier than what you might have should you go on an individual basis direct to the company utilizing systems outside of Insurance Bay. We do offer additional support to our agents, including discounted E&O. This is a program that you purchase at a very discounted rate, but it takes care of you for all your insurance products, not just the ones that you contract with through Premier Marketing. So it gives you an opportunity to make certain that, okay, I may not have all my eggs in one basket, which isn't always a bad thing, but I do have coverage for everything. So it's a very strong E&O program that can be different than some of the things that are offered by our competitors that only cover you for product through that organization. We do also offer discounted continuing education credit and a varied training program for other means of marketing. So you're comfortable getting in front of a population to the extent that you can grow your agency, reach your financial goals, and accommodate the need you have to serve the public that is part of your book of business. So a number of different programs that not only deal with product and specifics in that area, but a way of getting in front of the individuals to present that product or to be especially successful and maximize the opportunity you have with different marketing situations. We do offer also additional types of electronic support. There are many of us that write in a language specific to ourselves, and I refer to that language as chickenese. You can't read what you write. If you're submitting applications that way on a paper application, it delays the processing of that application. It will delay your prospect or client becoming effective in the program of their choice, and it'll delay your commissions. Look at these different e-apps that are available to you and consider very carefully the use of our Medicare Center program, which allows you to gather scopes of appointment electronically, even do remote enrollments without a face-to-face interaction. We have a number of programs coming up to discuss this as well, and we want to make certain that you have all the detail to make the use of your most precious resource, which is your time. We eliminate some windshield time. We eliminate a second or third appointment with an individual. It's going to really help your overall production. We also have a program that can help you put your social media efforts on autopilot, a program called Coverage Made Easy that will allow you to access Facebook and some of the other means of social media to help your marketing and awareness programs, in addition to your other types of marketing efforts. Speaking of which, what are some of those supports that we lend in that area? We do have custom contact lists available for you. If you are not afraid of Ma Bell and you like to cold call, that's a possibility for you when it's compliant. Keep in mind, you can't cold call for Medicare Advantage or prescription drug plans. You can't cold call for ERP MedSup either. You can cold call for all other MedSup options, and that gives you an opportunity to stay in the game and be proactive instead of reactive, as is the case with some of the other marketing options you may have available. We do have specific campaigns that can help you when it comes to community-based grassroots marketing programs. Retail programs are a big part of that. We recently had a webinar on that yesterday, and it deals with the different options that you have. A lot of times we'll speak to retail marketing and people automatically think of Walmart. Yeah, that's one of the programs we deal with and we offer. It is also one where there aren't any locations available to you any longer. We have a couple of carriers that are still offering locations. So that's something that is a very solid opportunity for you, and we'd like to go into detail in describing that for you. We also have specific sales tracks and opportunities with different faith-based organizations as well. This is a great way to reach a portion of the population that doesn't respond to other marketing inquiries and gives you an opportunity to stay active in your target market year-round by rotating the topics that are available to you for seminar selling. If you are uncomfortable speaking to a group, that doesn't mean this is not an option. That means we go to a camp-based program, but it is still available to you. And then, of course, there are the different marketing programs for providers. This isn't just the primary care physicians. Look beyond that to certain specialists, hospital systems, durable medical equipment partners, home health carriers, dentists, pharmacists that you look and work with on a year-round basis to own a particular market. And keep in mind that as we roll into EEP, many of our carrier partners will have leads that are available to you as well. And as you do business with some of these carriers, some of them will help you with marketing credits as well. The Authorized to Offer program with AARP, the Mutual of Omaha marketing support program, Washington National's campaign for ancillary products. A number of things pop to mind really, really quickly. If you are a person who wants to access internet leads, keep in mind that many times the folks that are responding to those types of outreach are folks that are looking to insure a house that's already on fire, but it is a grand opportunity for folks who want to use a different line of insurance to access their Medicare population. So working final expense through some aged life internet leads is a very strong option as well. And then there is our direct mail support program, which enables you to get into a regular mailing program at a strongly discounted rate based on production. We work through 4 preferred lead vendors. There are certain letters that we access for it simply because we are responsible for compliance oversight on it. So there are some things here that we'd be happy to talk to you about to get you additional mail support. As we go through this entire program, I appear to have talked much more quickly and sped through some of the benefits a little more quickly than I anticipated, but we want to be part of your marketing support. We want your business, and we're not shy to ask about it. So we have different opportunities that we've addressed now. Are there additional carriers that you need as part of your marketing plan? Are you not comfortable with the support or lack of support that you've gotten in the past, or your production or lack of production enables you to change things on a very timely basis? We want your business, and we want to work with you to make certain that we become a key partner for you moving forward. But that depends upon you identifying different programs that can become part of your personal marketing plan, and then you act on it. There's the old expression, when all is said and done, more is said than done. Now's the time. We need to work forward and work forward very quickly. This is the contact information for our Dallas office. Emails and phone extension. That primary contact number, 1-800-365-8208, will get you in touch with any Premier marketer. If you have a relationship with a Premier marketer now, I urge you to reach out to that number and ask for them by name. Ask for some additional information on the carriers that are unique to the land of Texas, the great and sovereign state of Texas. Let us make certain that you have that information available to you, the different marketing support programs from carriers with whom we partner that can really make a difference as to whether or not this is an okay AEP or this is the blockbuster year that you've been looking for. We look forward to the opportunity to visit with you. Keep in mind that this presentation is being recorded. A link to that recording will come to you. You'll also receive a PDF of this PowerPoint along with some additional information to help you formulate a marketing program, help you make certain you have the carriers within your portfolio to make you successful, and you have the partner with an upline that will help you do so. I thank you once again for your participation in today's webinar. I appreciate the investment of the time, your most precious resource. Watch for the follow-up, and we look forward to speaking with you in the very near future. That said, I'll let you go, and I wish you good selling. Thanks so much.